September is Suicide Prevention Month, and it's very important for our community to be aware of what suicide prevention can mean to us. The first thing that we can do is stop the stigma of mental health and the illnesses that portrays. Being aware of those red flags or those signs in the people that we love and care about is another way that we can help with that prevention. In regards to developmental disabilities and aging population, it's probably surprising to know that men 85 and older are the highest group of individuals that have had death by suicide. Developmental disabled individuals at a 42% rate say that they have had suicidal thoughts or have acted upon those suicidal thoughts. And mainly they're saying it's due to social isolation, bullying, physical pain, and just not wanting to be around any longer. One of the things that we have done is created 988, which is a national number that is available 24 hours a day. And so if you are feeling suicidal or you're having some thoughts, there is someone right at your fingertips. You are never alone. Just call 988 and someone will always answer. If you have a loved one or a family member that is feeling suicidal and you're not sure what to do, you can also call 988 and they can walk you through the steps that you can take to be able to help your loved one. The first thing that you can do is listen to your loved one. Take them seriously. If they are talking about having some ideations or having some thoughts on wanting to die by suicide, take them seriously, help them get some help. If that means listening to them, if that means getting them to a hospital or a therapist, those are the best things that you can possibly do for your loved ones.
I'm Kristen Smith, the Deputy Director for Developmental Disabilities. As part of Suicide Prevention Week, I'm going to talk about suicide prevention today. Suicide prevention means taking proactive steps to educate the community and others about the risk factors of suicide, how to recognize the warning signs, and how to seek help for yourself or a loved one. Suicide is one of the leading causes of death in the United States. It's important for anyone in a human services role to be knowledgeable about suicide prevention. We have the opportunity to use our platform and position to educate others and offer support to those who may face some of the strongest risk factors for suicide. Risk factors include anxiety, history of trauma, chronic physical illness or pain, social isolation, loneliness, and depression. If you or someone is struggling with suicidal thoughts, please talk to that person and ask them what kind of thoughts they're having. It's really important to keep that person safe. Encourage them to talk to someone. Call 988 and Suicide Prevention and Crisis Lifeline. Provide support options to them to seek assistance. It's really important to truly just be there for that person, remaining in contact with them and following up with them to remind them that you're there and you care.